name is Lovisa. I'm a musician. I live in London. This is my story about my hip arthroscopy. I couldn't find a lot of information when I was looking up hip arthroscopy and what it meant. I couldn't find a lot of videos of people who have gone through it either. So this video is meant to fill a space and a void on YouTube and other sources for those who actually need this operation. Please know that I'm gonna do my best to explain my process through this whole journey for you. And if you have any questions, feel free to ask in the comments below. Subscribe, click the bell icon if you want to follow me and see my latest updates, and let's get into it. This video is gonna contain every last bit of information that I have now the week before my surgery. So my surgery is scheduled to be in 6 days, and I'm doing this video to document the journey of my hip arthroscopy, how long it's taken me to actually get help, what I've gone through, what kind of management I've tried before operation was even on the table. I hope it can bring some sense of comfort to those of you who are going through the same journey as I have, and that might be approaching hip arthroscopy as the last option to fix their pain. I am not a doctor, I'm not a medical professional. This video is only my own experience within the healthcare system here in London. If you need urgent medical advice, call your GP, go to the emergency room, and get medical opinions from professionals. Conservative management is physiotherapy and any kind of procedure that isn't operational. It's non-invasive. In no particular order, I've tried chiropractic treatments, laser therapy, massage, orthopedic treatments. I've had an injection, physiotherapy, acupuncture, cupping. Did I miss anything? Painkillers, different strengths. The latest being cocodamol, naproxen, and amitriptyline in a very nice combination that doesn't make me nauseous at all. I've tried crying, screaming. I've tried just living with it. Stupid nose, it's itching. Hot and cold packs, Tiger Balm. I also have a TENS machine that I bought off of Amazon for like £27. If I compare that to anything else I've tried, it's probably helped the most. It sends electrical impulses into your muscles, forcing them basically to relax. So that works. I don't think there's anything to this point I haven't tried besides voodoo and magic. With a hip arthroscopy, they don't always know what they're gonna find when they go in. The hip joint is an area of the body that is very hard to see, even with an MRI, because the area in there is so tight. Without actually extracting the hip ball and pulling my leg out of placement, they won't be able to look in and actually see what's wrong. But that's what they're gonna investigate with this arthroscopy. My recovery could be longer or shorter depending on the amount of problems they find inside my hip. Hip arthroscopy is not a dangerous procedure. It's considered a minimally invasive procedure. It's a same-day surgery, so I should be expecting to go home the same day as the operation. It is, however, an operation that has quite a long rehabilitation time, depending on how much they actually have to fix once they're inside your hip joint. You're expected to be on crutches between 6 to 8 weeks, with 2 to 4 weeks of those being completely on crutches, not putting any weight on your leg whatsoever, and not bending your leg more than 90 degrees. There is of course a risk of having deep vein thrombosis, which are blood clots in your big veins. There is also a small risk of having nerve damage that is irreparable. These risks, however, are very small if you compare to the success rate. The success rate of this kind of operation is 85 to 90%. It might take time for the nerves to heal depending on how much they have to fix, but most people actually come out of this with no pain, no struggle, and no issues. I have a suspected labral tear. I also have a suspected ligamentum teres tear. When you have an injury in your body that causes mechanical dysfunction, it just causes a lot of discomfort, it causes a lot of pain, and it causes a lot of inflammation, and you wouldn't want it to turn ugly. It could be that you rip something that you really shouldn't rip off. So the sooner you can fix these kind of issues in your body, the better it is for you and for your future self. Isolation. I have to self-isolate for 14 days before my surgery and 14 days after. I have to come in and do a corona test swab as well, because that could give me a lot of health complications when I'm actually operated. My body would be fighting a virus, and it would also be trying to heal me from the operation. And those two won't go hand in hand. Simple as that. They asked me to come in for preoperative assessments again, because the one I had done in January this year was basically outdated. So on the 2nd of June I went in for blood tests, and I went in for a chest x-ray to make sure that I haven't had the coronavirus before. I had to do a MRSA test, which is a swab you do in your groin and in your nose. And because of the corona situation in the UK and our quarantine, they wanted to make sure that my lungs are actually fit and healthy. You might not have to do all of these things depending on how your health is at the moment, unless you are deemed to be at risk for something. I'm fit for surgery, so my surgery is going ahead on the 17th of June 2020. So on the day of the surgery, they're gonna take me in, I'm gonna get an IV, and the surgeon will come and speak to me. I will also get a meeting with my anesthetist. They will tell me everything I need to know. If I have any worries, I can ask questions. They will draw marks on my leg on where they will make the incisions. Then I will be put to sleep eventually. I will be discharged after, once I'm ready, and yeah, that's pretty much surgery day. At this point, I'm not particularly nervous. I'm very calm and I'm very accepting of what's gonna happen, because I've waited for so long. I've waited to be listened to. I waited to be taken seriously. I've been battling the healthcare and the doctors and nurses I've met here since 2016, because they didn't believe that I had an issue. They didn't believe that there was anything wrong with me. They thought that I was just over-exaggerating. And it took me 9 doctors to believe that there was something wrong with me. And the 9th was actually the one that solved this for me, that believed me there was a proper issue, a severe issue that needs to be addressed because conservative management wasn't working. There's actually help to get. It might take time, but you will get there eventually. There are good doctors out there. There are good people that will make sure that you get the help you need. You do have to be patient though, and you do have to make sure you do your end of the bargain. So if you do get physiotherapy exercises, do them. Make sure that you've covered all of your tracks. You have your back clear. It just proves that you're willing to do anything it takes to get well and healthy again. If the only thing that's left for that is an operation, then at least you've exhausted everything else. There are no counter arguments for them to make if you've tried everything that they offered. If you feel like you have an issue and you're having pains and you can't explain why and nothing you do helps, keep on seeking help. If the doctor in front of you doesn't listen to you, go to another one. Get another GP. Go get a second opinion. Make sure you have professional advice from different medical sources so that you can make an informed opinion of the procedures and treatments that exist out there, and so that you feel that someone is actually there in your corner fighting for you, because you're the one with the pain. You have to be the first and biggest advocate for yourself and realize that you deserve to not be in pain. I can't wait to have this operation done.